me to the moon and let me play amongst the stars. Let me see what spring is like on Jupiter and Mars. In other words, hold my hand. In other words, baby, kiss me. Fill my heart with song and let me swing forevermore. You are all I long for, all I worship and adore. In other words, please be true. In other words, I love you.
What I should probably do.
Fill my heart with song and let me swing forevermore. You are all I long for, all I worship and adore. Please be true. And fill my heart with song. Let me sing forevermore. You are all I long for, all I worship and adore. Please be true. In other words, I love you.
Good evening, everyone. Sami Diab, Colorado Medical Society, still present for the next 5 minutes or so, whatever time frame. Welcome all of you, and we'll get started in a few minutes here. Good evening, everyone. Thank you for joining us this evening. I'm Sami Diab, President of Colorado Medical Society. For a few more minutes, maybe an hour, until we welcome Dr. Johnson in that wonderful role. We will raise glasses later this evening to celebrate his inauguration. Before we do so, we have a great webinar and a great program for you this evening. Thank you so much for joining us. Momentarily, we're going to hear from Dr. Zarlengo with Copic. He's going to give us the always, we cannot wait to hear it from Copic type of approach. So Dr. Z, thank you for joining us. There's going to be exciting raffle tickets as well, raffle prizes donated by our partners in medicine. There's going to be live music throughout this evening, really kindly and nicely from Louis Petelnelli Entertainment. Thank you for doing that for us and be part of this evening. You'll even see a couple of pop-ups polls like the one you're going to see to help the board decide on the very important decision, which is what song to play next. So please choose your own music. Okay, we'll give it a few more minutes so you all can vote on the first choice, the Beatles, my favorite. Oh, I'm sorry, you can choose anyone. You don't have to listen to my choice. Yeah. Alrighty, so we'll close that screen. I think you all had a great time to vote, okay? So as you know, it was really our hope and plans to have this in person at the Wings Over the Rockies. I was really looking forward, Dr. Johnson, CMS staff, we're all looking forward to kind of feeling a sense of normalcy and getting together. Unfortunately, due to rising COVID rates, a new variant, lackluster vaccination rates, we want to play it safe for our members, for our families, and for all of you, okay? So we made a very difficult decision to make this really a virtual webinar one more year. So our sincere hope that next year we would celebrate, we'll raise champagne to the end of the COVID, and we can all hug each other and be together next year. So please encourage vaccination. The Colorado Medical Society is committed to providing our physician member the most relevant and timely information available. Dr. Eric France is going to join us as well and give us 30 minutes updates on the COVID. So he kindly accepted our invitation to join us. There's, you can see here some housekeeping items as well. So during the webinar, please use the Q&A function for your question. Do not use the chat. The chat will not be monitored. So we look forward to Dr. France's presentation, and we thank you for your participation. If we don't answer your questions, we're going to please address membership@cms.org for any of the questions. And I'm going to turn it over to Mr. Campbell next to guide us into the next part of this celebration.
Thank you, Dr. Diab. It's a great pleasure for me to introduce Dr. Eric France. He's the Chief Medical Officer of the CDPHE. He has been with us multiple times throughout the last year and a half of this pandemic, helping make sure that you have the latest information and the efforts of what the state is doing and how we can work together. It's been critical in helping us with our efforts to help increase physician vaccination and ultimately community vaccinations through helping provide vaccines to your offices to provide to your patients. So we are so excited to have Dr. France here today to tell us a little bit about what's going on and what's going on with Delta and what's going on with Mu and the rest of the Greek letters that I've forgotten at this point. And then again, please do use the Q&A function to send in questions. We'll have a little bit of time for Q&A after that. But without any further ado, Dr. France, so much for being here, and the floor is yours.
Thank you so much. Happy to be here. I look at that picture of me and think, those were times where I felt rested. I imagine you all feel the same. So again, it's too bad we're not all together tonight. I'm happy though to be here, to listen to some music, and to maybe have a glass of beer here while we talk here. So thanks for the music, Pettinelli Entertainment Group. My only disappointment is that as a panelist, I wasn't allowed to vote on that last song. So I'll give you guys an update about where we are with the pandemic and what you'll be seeing shortly. And I thought I'd start by just going over some of the material that I would typically review with our leadership team and the governor at the end of the day. And it always begins with this review of some data about where we are. So here's today's data. And as you can see, we have a column for cumulative cases, as well as those reported newly just in the last day. And so where are we here, September 17th? 2,000 cases reported yesterday. We've been sitting around that many new cases reported every day for the last week or two. Our week over week change seems to be flat or even declining, which is exciting. Our number that are currently hospitalized is just under 900 and seems to be declining. Again, good news. Our deaths are up by 25. This is a number that jumps up and down depending on the day of the week, but usually sits around 10 to 15 with an occasional higher number. And you'll see that we did 30,000 tests this last day, which is about where we run this time of the week. It varies by day, of course, and about 6% of our tests done are positive. So what does this look like from cases as we trend over time? And you'll see to the far right that our 7-day moving average for this fifth wave has been plateauing for the last 3 or 4 weeks. We're certainly not seeing that exponential growth experience that we had last October and November, but instead potentially a flattening number of cases. There is on the Colorado data page, a section that asks about incidence trends, and it's one I always dig in a little more to. It shows me the cases per 100,000 population as a 3-day average, and it's this top line that I'm looking at here. And you see on the right, there's a drop down. Here it's set for Colorado, but I could set it for Pueblo, El Paso, Denver, the southeast part of the state, and look at the trend in incidence per 100,000 over time. And of course, what's impressive here is that that dotted line, vertical line, is 2 weeks in the past. And you can see that for really the last 3 to 4 weeks, our incidence has been overall relatively flat at around 30 cases per 100,000. At our peak last December, we were running around 85 per 100,000. So this is all good news. And of course, it's vaccination that stay flat rather than exponentially grow. And so this is the table we review that shows us where we're at with vaccination in the state. And as you see on the first row, we look at how many people have had at least 1 dose. And 3 out of 4 Coloradans over the age of 12 have had a first dose. And almost 2 of every 3 have had a second dose. So that's good news. We're doing pretty well. If you look to the far right, you'll see the percent of 12 and older Black, Indigenous, and people of color that have been vaccinated, 63% with the first dose and 56% full doses. So certainly reduced by almost 10 percentage points from the general population, which is why we provide so much focus on our BIPOC communities. We're starting to follow the third dose just to see, as we expect to be giving those more, the boosters in particular here, rather than the additional dose for those with moderate to severe immunocompromised states. And we also pay attention to our vaccine inventory, which you see down on the second half of this slide. We have over 650,000 doses right now in the state. 160,000 of them are stored by the state of Colorado in our labs. And our orders are up. We're ordering more, in particular the J&J vaccine, which was in shorter supply and not coming in. We're starting to see more doses of the J&J vaccine coming in. Then I want to call out the number of providers we have enrolled who are actually giving these vaccines. And you'll see that second to the last row, 1,657 state and federal providers are now available, and 1,200 of them are with the state, and we have another 317 that we're enrolling. I'm particularly interested in primary care. We know that overall there are 1,550 primary care offices across the state, and to date about 30% of them have enrolled to become providers, and we're in the process with another 10%. So about 4 in 10 of our primary care offices are currently or in the process of enrolling to give vaccine, which is great. A lot of planning around the long-term care facilities, who are going to be at the top for our booster efforts. We have almost 1,100 facilities across the state, and we've connected with 1,000 of them and are scheduling appointments starting this next week with the hope of completing booster doses to them by the 3rd or 4th week from now into mid-October. So I'll speak more about boosters shortly. You can see in general, Colorado at the bottom quartile of 7-day incidence per 100,000. Unfortunately, the states to the north, Montana and Wyoming, are at those levels above 500 per week when it comes to 7-day incidence per 100,000. So it is around us. We are fortunate to continue to have lower rates, though they have been going up. We've been particularly focusing on children now that they're back to school. The blue-green line is the 18 and older, and you see that the incidence per 100,000 is actually higher for 6 to 11-year-olds and 12 to 17-year-olds. They do seem to have peaked and are maybe in some form of a plateau for the moment. Those numbers that we have in hospital, you see, are just under 900, and they are falling as of the last few days. So that's encouraging. Again, we're not seeing that steep upslope that we saw in last October and November, which is encouraging. And more importantly is actually the new daily admissions, because once admitted, you might be there for 4 days or you might be there for 14. Again, daily admissions are sitting around 75 to 130, but for the most part, it's been a nice plateau. It could be that we would have dropped, but for the extra exposures that happened around Labor Day. This is the time, we're now about 10 to 14 days after Labor Day, that we might see cases rise. In this instance, maybe thanks to our vaccination efforts and the actions of vaccinated folks being more careful, we just see a blunt plateau rather than a steep drop down. Who is hospitalized? Well, the good news is we only have 14 children hospitalized. So 854 of those hospitalized today are adults, 14 of them are children, 10 between the ages of 0 and 11, and 4 that are ages 12 to 17. So while kids are back in school, as you may have read earlier this week, almost 8 of 10 students in Colorado go to a school in which the district requires masks being worn. And even though we have high rates of RSV in our community right now, it is not COVID hospitalizations that are filling our pediatric hospital beds. This is a new slide that we're starting to follow that looks at hospitalization rates per 100,000 between the unvaccinated and the vaccinated. Two interesting things here, of course, is that there's almost a 5 times higher rate of hospitalization for those who are unvaccinated compared to those who are vaccinated. The other thing that's interesting here is that you'll notice that while the rise in hospitalization remains steep for the unvaccinated, it seems to have plateaued recently for the vaccinated. And you wonder about the selection pressures here, that those of us who were vaccinated are also the ones who are probably willing to be wearing masks in grocery stores and restaurants and maybe avoiding places of exposure, while the unvaccinated might be continuing to be in places where they're likely to become infected. And so that might explain why vaccinated hospitalizations have plateaued a bit over the last week or two. Our death rates went up, in August and September. Certainly, again, not at the steep rate of the last fall, but they did go up, and they are more people older age, some of the more typical age distributions, I believe, for deaths overall. We've been following something similar to this for many months. And if you notice, this is the rate per 100,000 on the vertical axis and the percent vaccinated on the horizontal. In this instance, we're looking at deaths. And you see this very strong correlation that the higher your community is vaccinated, the lower deaths per 100,000 that community is experiencing. And early in our vaccination efforts, we were looking at this, but with cases and hospitalizations. And I knew there was a bias because people who could stay home and work from home, people who were most worried were the first ones to be vaccinated, but they also had some of the lowest risks of getting disease. So there would be a bias in how this kind of correlation would be shown. I feel stronger, though, that this is a true correlation now that we've had many months of opportunity for vaccination. And it's a strong correlation. So clearly, if you're in a community that has lower vaccination rates, there'll be higher death rates per 100,000. Of course, over the summer, the demand for community vaccination faded, and it became more of an effort to meet people where they are. And we did that through our mobile vaccination clinics, where we have these buses that go across the state. We've been working closely with businesses who want to do a vaccination program. And of course, we've been working hard to engage with primary care doctors, because really, this is that flatter part of acceptance of a vaccine, where our kind of marketing at the state level isn't really going to have a profound impact on numbers, but the kinds of real conversations that you have every day with patients and having that vaccine right in your clinic so you can give it to them at that moment is really the strategy that's going to keep us creeping up on our numbers. You'll remember we did offer some gift card through Walmart and some Chipotle gift cards. And before we started this towards the end of July, we were giving about 3,500 to 4,000 doses to people who hadn't been vaccinated a day. And once we started doing the gift cards, that bumped up to more like 5,500 to 6,000 doses a day. So it was an effective way of pulling people in who might have been planning to be vaccinated, but just hadn't done it yet. I think we're just about done with our Walmart gift card program. It will likely, I believe, end, if it hasn't ended already, it will be done by the end of this month. So that's been a helpful way of incenting people to be vaccinated. One area that we focused on during the month of August with this 30-day push was to build a new program to encourage primary care doctors to be vaccinators. As you heard, 4 in 10 are currently enrolled or in the process of being enrolled. And we know it's those conversations with their providers that will help move the needle. So we have this new program in place where we have $60 million available to primary care doctors to help support you become enrolled and have the resources to vaccinate people in your offices. We started this September 2nd. We expect to be done with them by February 28th. And any primary care office can go to our website, learn about the details, and apply. You can also just send an email, as you see here. And so if you Google Colorado primary care vaccination, you'll find this coming up. There's a lot of different reimbursable expenses. We know that personnel is a big issue for your efforts to vaccinate. It's hard for you to find people and hire people. You need infrastructure support. Maybe you need refrigerators. Maybe you need help getting connected to the Colorado Immunization Information System, supplies and equipment. All of that would be covered through this grant program. So I hope that you all primary care, if you haven't done so, you'll consider this. The amount of funding by clinical site depends on the number of providers that we have there. So you can see these different levels of $60, $90, and $120,000 maximum, depending on the number of folks you have. And of course, we do have money to help you buy compliant storage units to store them. And we have these free digital trackers that will keep track of the temperature of your storage units that we can make available to you as well. As you know, I imagine Medicaid is reimbursing at $41.18 per dose. HRSA will reimburse for uninsured patients. And I believe there's conversations at Medicaid and HCPF about whether there may be an opportunity to increase that rate above $41. We also have dollars from the federal government that will expand our efforts in our marginalized communities. And to do that, we have $16 million to support equitable vaccine education, distribution, and administration. There's other monies for engaging with the community. There's a program to provide wraparound services that is essentially helping to encourage people to be vaccinated. And there's community navigation dollars as well. So if you contact me or again through the primary care program that you saw before, we'd be happy to let you know more about it. You'll be hearing more about this. We're still developing the grant program. We at the state need to identify an entity that would manage this money and the grant program. And I believe we're just finalizing who that entity will be. And once that's done, we'll do a lot more to let you know through CMS and other venues about this grant program. So one of the big news issues, of course, today was the Pfizer booster review by the Vaccine and Biological Products, Related Biological Products Advisory Committee of the FDA. So this is a group of experts who provide advice to the FDA. They met today to review what was presented on whether we ought to be providing a booster. And essentially, as you know, Pfizer has a biological license, and therefore Pfizer was petitioning the FDA for an amendment to their license to provide regulatory allowance of booster use for 16 and above. The 18 members of the VRBPAC voted, as you see, 16 against and 2 for. One of the big issues was that the question at hand was for 16 and above, and the group really didn't feel like they had the safety data for those who were between 16 and 29. For example, we know that the risk for myocarditis for the 16 to 29, I think, runs around 1 per every 5,000 to 6,000 doses given. But that's a much lower rate than if those same people actually got COVID. And so if you've been given 2 doses of mRNA vaccine, is the incremental benefit of getting a 3rd dose more than the incremental risk, again, 1 in maybe 5,000 or 6,000 of myocarditis. So they just didn't feel like the safety information was there in the packet. Instead, they recommended to the FDA that the FDA put together amendment to the emergency use authorization and recommend that adults 65 and older and those 16 and over who are at high risk of severe COVID-19 should receive a booster 6 months after their initial series completion. They also agreed that healthcare workers and others at high risk for occupational exposure should be included in that EUA expansion. So that was the advisory council making recommendations to the FDA, and that finished today at 2 our time. So now, between now and sometime next week, the FDA itself will decide, okay, we're not going to do the amendment to the license, but will we do an EUA, and will we follow the recommendations of our council, or will we recommend something else? So we'll hear in the next few days what they think and whether they're going to do this new EUA amendment. Right now, as you know, the ACIP then looks at this EUA and makes specific recommendations about who should be vaccinated. And ACIP has announced that they will be meeting on Wednesday or Thursday of next week to discuss changes. And so we'll see, will the ACIP move itself up a day or two if the EUA is announced tomorrow? I'm not sure. Will we be waiting after the FDA has said there's an update on the EUA and we have to wait 5 days for the ACIP meeting? I'm not sure. I know our governor is ready to go, and waiting for ACIP later in the week, it might be difficult to hold everybody back. So the CDC has told us specifically that we really need to await the ACIP recommendations before we do booster administrations for COVID-19. The other big development of late has been around the monoclonal antibodies. And I think, as you know, these have been shown to be 70 and 80% effective at averting hospitalizations. They also reduce your symptoms by 4 days and have been shown to be effective against the Delta variant. They are the only outpatient antiviral treatment that's available, and we have these 3 different options available to us here in Colorado. And some of you may remember me speaking to you about these last November or December, and the traction and interest has been relatively low for these over the first 9 months of this year. Let me change that to say the 7 months of this year. The last month, we went from maybe 50 people getting it to 400 people getting it each week. And the demand really has increased. And because that demand has increased, the state has been working to think about, could we create treatment centers that you could refer people to? We know that everybody's busy, that there are 4 issues at hand. There's taking care of people who are sick. Your staff is busy with that. There's vaccination, staff are doing that. There's monoclonal antibodies, and now we're in a staffing crisis too. So all of this happening at the same time. Well, so can the state do something and create centers where you would refer people to receive treatment? And we know that the subcutaneous Regeneron injection for subcutaneous shots is a viable option, and it doesn't have to be an IV infusion. The infusions themselves are now moved from 60 minutes down to 20 minutes, but whether it's an infusion or the sub-Q injection, it still requires an hour of observation afterwards. It's believed that there's no difference in the efficacy of these monoclonal antibodies between giving it as an infusion or sub-Q injection. And that's a question that comes up because of the way the EUAs were written, but there is no preference between the two. And in my mind, the sub-Q is something you could do maybe in a more broad fashion. And I think states like Florida and Alaska have set up sites where sub-Q has been used in this regard, and they could do larger numbers of people. So we've talked with 3 different entities to be contracted with the state to set up these treatment centers. Now, unfortunately, on Monday evening, I learned that there was going to be changes with how these monoclonal antibodies would be distributed across the United States. The demand had risen so quickly over the last 5 to 6 weeks that it was clear we were nationally going to run out of our supply. And so the federal government, HHS and ASPR said, we will only go through 150,000 doses a week for the foreseeable future. It's unclear to me how much of a supply we have and how long 150,000 a week will last. What that means is that our own state will now be limited as to how many doses that will be coming to us. A week ago, any entity, your office, a hospital, could order directly from the distributor for these treatments. Please send me 100 doses, and I'm a hospital in Western Colorado. That is no longer feasible. Instead, the State Department will be told by the feds, you will have 960 doses total coming to Colorado this week. Please let us know where you want them to go, which of the facilities should get them, and how many doses should they get. So again, This is just since Tuesday. And so we've been scrambling, as you might imagine, to understand who needs doses, who has doses already in storage, who needs more, where you're using it. And so we're quickly working through that, gathering information. We have about 90 facilities that have requested doses across our state. And we gave about 450 doses, maybe not, if not last week, it was the week before. So we have a website that does list some of the sites that we know of. It's only about 31 of the 91, however, that are actually here. So there is a lot of work underway. Again, stay tuned. We'll be distributing it using a model probably to begin with based on who's been using them, who's experienced with using them. I imagine we'll look at vaccination rates. We'll look at whether the hospital in your area is nearly overrun with cases, and therefore maybe we should have more doses going to your area. So that's all going to be worked out, I hope, within the next week. So a lot happening with monoclonal antibodies as well. So let me finish by just share with you how I'm thinking about what things look like over the upcoming months. Over the next short term, my hope is that we'll have a flat to slowly increasing hospitalizations, that again, it will be the unvaccinated who will be predominantly in the hospital. Our death rates will likely remain low given the high vaccination rates of those who are most at risk for dying from COVID. Our COVID-19 spread in schools will hopefully stay in check based on the guidance that we've given from the state and mask use and distance and ventilation. We'll see what happens in the schools in the coming weeks. We're following that very closely. We'll start vaccinating folks sometime in the next week with boosters, and we've got more than enough capacity to give boosters both in residential care, in the existing pharmacy centers that we have, as well as in clinics. And we'll be somehow developing this new monoclonal antibody distribution and treatment program. If we look a little further over the next 6 months, well, certainly we're focusing a lot now on the flu season. Thank you for all you've done to make sure people got the flu vaccine. The result of those flu shots and some of the non-pharmaceutical interventions of distancing and working from home was that we had almost negligible flu season last year. And that would be very helpful for this coming year, knowing that we're pretty much back to the same level of people moving around. Mobility levels today are like they were pre-pandemic. So there will be more flu this year. They will be in our hospitals. So more we can do to vaccinate with the flu, the better. We hope to see this expansion in primary care. We know that at some point, end of this year, there will be an EUA for vaccinating 5 to 11-year-olds. And we will lean on primary care offices in family medicine and pediatrics to do that. So work with us with some of those grant monies to build out your capability to provide vaccines for the 5 to 11-year-olds. And then, you know, in some ways, I'm sad to say that our work is to control the burn, because there will be people who will remain unvaccinated. And if they're unvaccinated, COVID is coming to them at some point. My hope is that we don't have them all get sick at the same time. So we have to control that burn. We have to moderate the speed of that burn so that our healthcare workers aren't overwhelmed and our hospital beds are not overwhelmed. So if there was a scenario where the hospitalization rates got quite high, the state and local public health will start looking again at whether there are other things we might do, like require vaccination if you're in public places like restaurants or movie theaters or events. Are there other non-pharmaceutical interventions that we would have to consider again? Governor Polis is pretty clear that his main concern is protecting healthcare workers and hospitals, and that he doesn't want to exceed local control efforts unless he absolutely needs to. So that's my update. And with that, I'm happy to take questions.
All right. Thank you so much for that update, Dr. France. We've got some questions that are coming in right now, so we will get to them. The first one is, and this is regard to the third dose on the Pfizer vaccine. It said that those with high risk of occupational exposure. Could you define high risk, and does this include educators?
Yeah, great question. I think the advisory council meeting today heard loud and clear that it would be important to vaccinate healthcare workers, and in particular for staffing reasons. You all do well at avoiding infection through your PPE, and because of your high rates of vaccination, the risks of severe disease and death among healthcare workers is low after you've had those first 2 shots. But we all know people, friends who've been having breakthrough cases. And if it's a nurse on your floor who has a breakthrough case and now is 10 days home in quarantine, that's having an impact on clinical care you provide. And so the general idea was that it would be important to vaccinate healthcare workers because even with mild disease, it impacts the way you can provide care. So of course, as it goes, it's, well, if healthcare workers, then who else? And the advisory council to the FDA didn't have time to do that. And typically that would be more the work of the Advisory Committee on Immunization Practices, the ACIP that meets on Wednesday and Thursday. So I know that will be a priority to say who are in these groups that we would recommend should be getting a booster as soon as possible. And, you know, strained staffing issues may be a theme that they review, as well as the fact that they're thinking about who's particularly likely and potentially hospitalized if they do have a breakthrough case.
Thank you. A couple of questions about monoclonal antibodies here. One is from Dr. Pallet that says long-term care facility residents are waiting for monoclonal antibody doses, but those sites are not registered infusion centers with CDPHE. How can you ensure that the long-term care facilities are included in the plan to distribute the monoclonal antibodies?
Yeah, that's a great point. So some places registered with CDPHE, and they're on that map that we have with 30 odd sites, and but many are not. And so there is a distributor, a company called AmerisourceBergen, who's tasked to send the supply from the federal government to all the sites. And AmerisourceBergen has a spreadsheet with a list of all the different entities that have requested the monoclonal antibody in the past. And on that list will be long-term care facility pharmacies. I think you may call out a good point, which is like, well, maybe I was never on that list and now I want to be on that list. So one of the things we'll have to solve for at the state level is to be sure that we have players who've never played and want them to be included in this list and in this consideration. So if you've already ordered them, then we have your name. If you're likely to order in the future, then we'll likely through communications tell you how to connect with us in the coming days and weeks.
Great. And then a follow-up question, Dr. Matthew Winia says, do you have any thoughts on the new NIH guidelines to use the monoclonal antibodies, mainly for patients who are not vaccinated if there's a shortage?
There are some new guidelines that can be helpful from a broadly speaking. They say things like, it's best to, if you have a limited supply, use this for the unvaccinated before the vaccinated as a principle, since the unvaccinated has a much higher chance of being hospitalized or having severe illness. And potentially consider these groups as being at higher risk. Use it for treatment purposes for someone who has a positive test before you use it for post-exposure prophylaxis, for example. There are limitations to those recommendations. They don't really help you to decide, should I do my 50-year-old diabetic, or should I do my 28-year-old morbidly obese with asthma? And of course, that's where it's going to be left, I think, the medical decision-making. It won't be decided by the state in that regard. So we'll be looking at different ways of distributing. How many doses should go to long-term care? How about corrections? How about hospitals? We may have to think at the state level some broad categories if we have a limited number. And then maybe we let you decide amongst your patients who are at the highest risk. I know some of our health systems already who are using lots of these are having much more demand than they have doses and are having to make those difficult decisions, prioritizing people with immune compromising conditions or who they believe are particularly at high risk for hospitalization over others.
I'm going to summarize a question from Dr. Glasser, who is essentially asking about policies at Broncos games, Rockies games, other outdoor events where the policy is generally that if you're not vaccinated, you're encouraged to wear a mask and social distance, but the ability to social distance in those environments is virtually zero. What can and should the state's role or CDPHE's role be in issuing guidance there?
I think it comes back to the numbers. And because cases have been flat, hospitalizations have been flat, the governor and I think at the state level in general, there isn't this worry that we're about to have this exponential growth in hospitalizations and therefore something should be changed. You know, it's always the balance about mental health, economic health of communities, and prevention of the pandemic. And I would say that beyond the guidance that's been given, and given both by local public health agencies like Denver for the Rockies and for the Broncos, I don't think the state is going to intervene at this time to require something different. I think that could change if cases really went up and we were at risk of overwhelming our healthcare system.
Understood. We are getting close to time. We have several questions, and so I'm going to try and play speed round here with you, Dr. France, if we could. Dr. Arendt asks, should we be spreading out the flu shot and COVID boosters or be giving them at the same time?
No, I think it's fine to do it at the same time.
All right. Is there any update on crossing vaccination series like Canada has done, Pfizer to Moderna, J&J to Pfizer, or Moderna, et cetera?
It's going to be a real issue that the ACIP might comment on next week, because what do we do with people who had the primary series of Moderna six or more months ago? Do we recommend Pfizer? I doubt that will be the case, but so stay tuned.
What does the actions today at the FDA and what we might see next week, how does that impact? That's obviously based on the Pfizer vaccine. What does that impact on the status of boosters with the Moderna vaccine?
Well, the governor was good tonight at reminding us that pretty much anybody who it's been 6 months or more, they've all pretty much got the Pfizer. So our first round is Pfizer anyway. Again, I'm going to wait to see what the ACIP says about whether they're going to recommend an EUA change for a booster of Moderna with Moderna. I will call out one little thing. If you have Moderna and you say, I'm going to do off EUA half-dose boosters with Moderna, and you have a vial, that vial was made and approved for 14 pokes. It wasn't approved for 28 pokes. And are you at further risk of potentially causing passing around of infections in a bottle that isn't made for 28 pokes? If Moderna becomes a booster and it's a half the size dose, it's likely it would be in a different form of packaging and not one that would require 28 pokes.
All right. And I apologize that we are not going to be able to get to everybody's questions. We're just running short on time, and appreciate that Dr. France has been able to be here with us. I'm going to ask one more, and I appreciate Dr. Phyllis Bergeron was the first one in with the question. She's waited patiently. She just wants to know if you could address the plans. And this was back when you were talking about increasing the vaccination rates for the Tri-County Health, Douglas County, and Aurora areas.
Well, in some ways, it's a challenge that we're kind of at this plateau where everybody who wants it has gotten it. And so we're not really increasing primary vaccination very much. And the way that will happen, I think, is when they walk into your clinic, they see you, you recommend them, and they say, okay, I'll do it, which is what happens with the HPV vaccine and many other vaccines. And so that's where we need to go to really improve it. For our marginalized communities, we're going to be doing a lot more of these place-based interventions like we did before, pop-up clinics to make it convenient and accessible for those neighborhoods to get vaccinated with the boosters.
Wonderful. Dr. Eric France, thank you so much for taking the time today. Tons of great questions. Who knew that, 18 months into this, we'd still be having so much information to pass along, but appreciate everything you've done to provide that for us. And thank you so much for being here tonight. And feel free to stick around and enjoy the party and hope maybe win some raffle prizes too. Thank you so much for being here. Now we're going to go into the annual meeting portion of our program. And I just want to point out to those whose questions we did not get answered, we have recorded those. We're going to work on getting those answered offline for you and respond back. Also, if you have any additional questions that you can think of, please feel free to email them to membership@cms.org, and we're going to do our best to get those out to you early next week. So we're going to move on now to our program. And, if we were in person, we really had some big ideas for raffle drawings and things like that. And unfortunately, as we've just heard with the spike that we saw, we had to make the determination to go virtual. But we're going to do our best to still have some raffles and some fun tonight. And so just stick around. You must be present to win. So hopefully everyone will stick around to the end of the meeting here. And before we get started with that, I want to bring you a quick word from one of our sponsors, RPM Medical Billing, who's one of our partners in medicine.
Hi, I'm Ryan Davis, Chief Operating Officer of RPM Medical Billing. We are a full-service medical billing company serving Colorado practices like yours for over 10 years. Practices that switch to RPM Medical Billing increase their collections by an average of 5 to 10%. Our team is trusted, transparent, and local. Contact us today to schedule your free billing consultation for CMS member. Let us transform your revenue cycle so you can focus on what matters most, providing life-changing care for your patients.
Excellent. And so throughout the evening, we are going to be having raffles, and we're working with the technology. So instead of balls or pulling it out, we're gonna try and play with some technology here to hopefully you're going to be able to see a wheel. We're going to pull the names out of the attendee list and drop that into this wheel and spin it. Our first raffle is from the partner that you just heard from, RPM Medical Billing, and this is for a 6-month coffee subscription to Beanbox. So I'm gonna cross my fingers here, and I'm gonna ask if Chris could go ahead and put up the wheel. All right, so that should be everybody's name who's in the chat. Sorry, staff, we're gonna make ourselves not eligible for this one, but every physician who's here and everyone who's attending should be on it. And I think, let's see how this works. Let's give it a spin. And the winner will be contacted by staff, and we will get that either physically mailed or emailed to you based on that. And it looks like, wow, look at that. CMS board member, Dr. Brittany Carver. She has had to suffer the majority of the day being on Zoom with me for our board meeting, and that is her prize. She gets to stay awake next time. So congratulations, Dr. Carver. And we're going to have more of these coming up throughout the evening. Special thanks to RPM Medical Billing, our partner in medicine, for that. And you can learn more about RPM and our full Partners in Medicine program at our website, cms.org. The next raffle drawing is going to be for some Broncos tickets. So stick around for that. We won't comment on the social distancing part of that. We just assume that everyone here is going to be vaccinated and enjoy that well. So in just a few moments, we're going to share champagne and or sparkling apple cider toasts, saluting Dr. Diab and welcoming Dr. Johnson as the new president. But before we get to that, we have the results of our first poll. And the most voted request is What I Like About You by the Romantics. So take it away. And after that, we are going to hear from Dr. Diab and a special message from Copic. Take it away.
Hey! Uh-huh. Hey! appetite. Tell me you're the only one wanna come over tonight. Yeah, keep on whispering in my ear. Tell me all the things that I wanna hear, but that's true. It's what I like about you. What I like about you. You really know how to dance. Go up, down, jump around, think about true romance. Yeah, I keep on whispering in my ear. Tell me all the things that I wanna hear, but that's true. What I like about you. What I like about you. That's what I like about you.
Okay, I wasn't sure if there's a Copic commercial or not, but I'll go ahead and introduce Dr. Z, okay? Dr. Zarlingo, we all know you as Dr. Z. Thank you for being here, and we're going to have you live. You know, we all know that Copic is the Colorado Medical Society #1 strategic partner. Thank you for that. Thank you for all the support and really the relationship we have together. We make each other stronger in this process, okay? We all know, I personally know from my practice at Rocky Mountain for over 20 years that there's no medical liability insurer who cares more about the physician than Copic. Every time I called for a situation, I got an answer immediately right away. I felt respected. I felt that they care about me. So really, thank you so much for that service that you provide to the physicians of Colorado. We are so pleased to have you, Dr. Z, for a brief update and presentation of the Copic 2021 Humanitarian Award. So Dr. Z, the floor is yours.
Thank you, Sammy. So real quick, I'll just give you a 30-second update. Copic had a record year last year in 2020. Despite the pandemic, we're able to stay on track and continue to grow. This year is continuing to go down that road. That benefits all of us because it allows us to continue to really have the ability to do what we do, and that is live our mission and really support improving medicine in the communities we serve, which is what our mission statement is. So short, real quick, just everything's good at Copic, and we continue to try to grow and be a strong company and continue to foster the relationships we have, particularly with medical societies like CMS, which is the longest relationship that we've had. So the other part of my presentation tonight is the fun part. And that's the part that's always good, when we can give away some money and we can recognize individuals in our community who cause the rest of us to be humble. So I'm going to start and just give you a little background. The Copic Humanitarian Award was started in 2001 by one of our board members, Harold, he went by Hal Williamson, who was not a physician. But he initiated the award, and he said he specifically felt that we should look to recognize individuals who unassumingly volunteer outside the spectrum of their daily lives. We all work hard. We all work hard in practice, and to take that extra time and actually go above and beyond to support the community is really what this was about. So in relation to this award, we give away a $10,000 award that can be given to a 501c3 organization that is directed towards improving healthcare. So in 2021, this year, Copic and CMS decided to create a partnership to present this award and award it to a deserving CMS member. I am pleased to announce that this year's award is going to go to Dr. Ted Ning. I have a personal connection to Dr. Ning in that when I was an orderly years ago in trying to get into medical school, he was just starting in practice, and just remember him from the get-go when he first got into practice. Dr. Ning is a successful urologist who decided to leave his practice at age 50, and he became involved in nonprofit organizations, local and international communities, that his commitment was towards addressing social issues. Beginning in residency, Dr. Ning spent countless volunteer hours working at the Denver Free Clinic and running Operation Baby Lift. After residency, he continued to volunteer efforts by implementing and growing numerous nonprofit organizations. Throughout the years, he's volunteered his time in causes that empower women in impoverished countries like Guatemala and Vietnam. Additionally, Dr. Ning has served as founding board president for Resilience 1220, which provides free counseling services to youth ages 12 to 20 in mountain communities west of Denver. Through counseling, support groups, and community outreach, Resilience 1220 works to raise the awareness of the social, emotional, and mental health issues young adults face, and to provide the necessary life skills to create real wellness and resiliency in their lives and help get them on track. The list of Dr. Ning's volunteer activities, contributions, recognitions is exhaustive and extensive. For these and many other reasons, Copic, partnered with CMS, have selected him as the honoree of the 2021 Copic Humanitarian Award. Dr. Ning has chosen Resilience 1220 as the beneficiary of the $10,000 donation associated with the award. So again, I stand humbled, and I ask you to help me acknowledge Dr. Ning. Happy to take any questions. Other than that, I think I may have even got you back a few minutes.
I appreciate that, Dr. Zarlengo. Thank you so much. And I apologize, we had a little bit of a technical glitch there. We have a commercial for Copic that we're going to run, I think, here in just 1 second. When it pops up on the screen, I will toss to it. But in the meantime, I know that we've got people back behind the scenes that are trying to balance it. I know that we're going to go choose your own adventure. All right. We're going to do the Copic commercial. So we're going to hear that. Once again,
hello, I'm Dr. Jerry Zarlengo, the Chairman CEO of Copic. Copic's mission is to improve medicine in the communities we serve. We are the endorsed medical liability insurance carrier for CMS members and go beyond basic insurance coverage to offer educational resources, expert guidance, and proven programs designed to address healthcare risks and support better outcomes. Founded by Colorado physicians, Copic is backed by decades of experience and a long-standing relationship with CMS that focuses on maintaining a strong, stable healthcare environment. CMS members get a 10% discount on their coverage. Learn more about what sets Copic apart at callcopic.com.
Wonderful. Thank you so much for that message, Dr. Zarlengo Z, and thanks again for being here tonight. Thanks for presenting that wonderful award. Now, we do have a little bit of business that we need to get to this evening. And I believe that we're going to be seeing some names up on the board. We actually do need to approve the nominees for our Compact board. Compact is the nonpartisan political action committee for the Medical Society, and they do great work under the guidance of physician volunteers that help guide Compact with your donations. And hopefully we'll be getting that PowerPoint going. This is the beauty of live television, as it were. Great, here we go. So this is the slate of nominees for the Compact board. I want to give you just a moment to review those names. And you have a poll that had just popped up. All CMS members in attendance, you have the ability to vote in favor of this board. Please vote now. yay, nay, or abstain on this board, which will serve as your compact board for the next year. Take a moment while we get those votes in. All right, just waiting for a couple more people. I'm waiting to get the thumbs up from our team to make sure that we've got the votes. All right, we have a unanimous, well, sorry, not unanimous. We have a very strong majority in support of the slate of nominees. There we go. There are the results, 90%. A couple of abstentions. So thank you so much, and appreciate those who have volunteered to serve on this board for the next year. You know, the compact is really the lifeblood of a lot of the advocacy work that we do. Some of the really important work that the Medical Society does to help protect the practice of medicine is done through the support of compact, and appreciate the hundreds of you that support compact with your donations, encouraging all of you to participate. Anyone who contributes to compact this month is actually going to be entered to win a drawing to win an iPad or dinner at Elway's Steakhouse. You can contribute up to $625 to compact, and then our small donor committee, that's only $50. So just with the donation of $50, you can help contribute to the great work that the Medical Society is doing. So thank you to everyone who has already donated. Thank you to everyone who's voting. Thank you to those who are serving on the compact board next year. All right, now I believe we have time for a couple of drawings before we hear from Dr. Diab, who's going to give his outgoing president's address. The first raffle item, of course, is provided by Copic. So this is a $150 Amazon gift card. So thank you so much, Copic, for providing that. And this is also from Copic Financial Services Group. And I think we're going to try and go back to the Wheel of Fortune here and see if we can draw ourselves our second winner of the evening. All right, here we go. All right, let's give that thing a spin and see if we can find ourselves another winner tonight. All right, Rasa Rafi. Dr. Rasa Rafi is the winner. So congratulations, Dr. Rafi. And you're going to be getting a chat message here in just a minute from Chris. She's going to make sure she has your contact information, and we will get that out to you directly. Thank you so much. And now we have a pair of tickets to Broncos home game against the Raiders on October 17th. This is provided by our partner in medicine, the Colorado Drug Card. And so thank you so much to the Colorado Drug Card, a great partner for CMS. And now we're going to go ahead and spin the wheel one more time. All right, need that little Wheel of Fortune music behind there. And wouldn't you know it, Dr. Eric France, he stuck around. Thank you for the presentation, Dr. France. It wasn't rigged, you all saw it. Thank you so much, Dr. France, and enjoy the game and social distance mask. And we know you're vaccinated, but we know that you might have advice for some of the people that you see there. So, all right, now we are going to just have a little bit of a music interlude as we kind of shift things around here. And after our next song, you'll be hearing from CMS President Dr. Sammy Diab. Talk to you all in just a moment.
Show me how you do that trick. The one that makes me scream, she said. The one that makes me laugh, she said. Threw her arms around my neck. Show me how you do it. And I promise you, and I promise that I'll run away with you. I'll run away with you.
Where's the video? There you go. Okay, great. So my last comments as president, it's I don't know what to say. First of all, I want to start by thanking so many people. So I'll do it quickly. CMS staff, you've been amazing. Really, your support, your availability. Thank you so much for all your hard work. You can see the President Council behind me. Dr. Lazarus, Dr. Perry, Dr. Downs, and then the leadership team. Dr. Markinson couldn't be here today, and then Dr. Johnson. They've been there, available to ask advice, meet frequently every 2 weeks and stuff like that, and being here tonight just to celebrate that special day. So you guys always had the back of CMS and my back. So thank you so much for that. Really, board of directors, you've been great. Physicians of Colorado, thank you for giving me the opportunity to be the president of Colorado Medical Society. Your trust means the world to me, and you have my promise to keep engaged in organized medicine. Thank you to my family, to my wife Lillian, to my kids Nick and Christopher, to my parents George and Mary. I couldn't do this without your love and your support. So here are my comments. We all heard a lot about ethics and professionalism and value care. I decided that we need some therapy. So I'm going to try to make you laugh. So let's see if I'm successful. So Dr. Johnson, I made a lot of mistakes here. And I would like to share, some mistakes and some advice with you, okay? And hope you can benefit from them, okay? So I'm going to make fun of few peoples here, including myself. Please don't take it personal. We're just here to laugh and have a good time, okay? So as a president, Dr. Johnson, don't try to go to every single committee meeting, okay? You will need, if you do, you will need the help of the well-being committee. Now, we all love to travel. So Dr. Johnson, pick your favorite spot in Colorado and request a site visit from CMS. Now, when you're tired of running the board meeting, and that will happen, okay, just schedule your next medical procedure at the same day as the board meeting. I say that's the only time I can get it because of COVID. Okay, now, how do you deal with the president-elect? So the president-elect role is very important. So the nice thing about the president is you can delegate what you don't like to do to the president-elect, but you have to do it with a smile and a thank you. So do that. Okay, immediate past president. This is a tough one. Okay, so we all know that the immediate past president, okay, it's really not a paid position. Okay, I was told by Dr. Markinson, and I don't know if that's true or not, it's part of the president honorarium. So if this is the case, what I decided to try is to send you a contract with my hourly rate. So we'll try that. Board of directors, we all know that you read your package all the time before the board meeting, okay? So, but just to try it, just to make sure that we're not missing anything, the board of just include a link, okay, to some Broncos tickets. And if they read the package, they will click on the link. If you don't get a click, that's mean they didn't read the package. Now, the committee chairs, okay, I really want to, the value committee, Dr. Downs did just an amazing job. I mean, on top of the value proposals, a lot going on. So really, this is not making fun of anybody, but this is, the value committee is met on regular basis every month, very active. So really, sincerely, thank you so much for that. I know you're, turning the leadership of the committee, but we will miss you, and I'm sure you're going to be engaged. Now, other committees, I think I sent the memos, and the memo had an error. Okay, it had a typo, and the typo said you have the choice to meet on a yearly basis. So just make sure that your memos do that is accurate frequency of the meetings. Now, we couldn't make this fun without talking about Brian, our CEO, okay? So you're going to meet with Brian, the CEO, on a regular basis, okay? Please try to avoid any discussion about sport. Otherwise, you'll miss your next meeting. Okay, this has really helped me a lot. You have to make good friends with Copic leadership. If you get in trouble with CMS or with Brian about a position you took, just tell him that you're honored by Copic and they felt it's important for you to take that position to keep the Copic discount going. So, staff, it's amazing staff. CMS staff is hardworking. You know, they're all hardworking, but I worked with Chet on a regular basis related to policies and advocacy. And here's my advice, you know, if you need to talk to Chet, try to do it before 3 p.m. Okay, he works a lot, but try to do it before 3 p.m. Very simple reason for that request. The sophistication and complexity of the analogy and vocabulary will escalate significantly after 3 p.m. I was always using Google Translation. Okay, now, you know, we all have thought of the email stuff, right? CMS staff always very responsive. You call them, you know, they always respond. But, you know, emails, sometimes that email inbox can get out of control, okay? So one way to really get around that is just have their cell phone number. And if you don't get a reply to something you really need a reply to, just call them on Saturday at 6 a.m. and that will take care of the problem. Okay, thank you so much for giving me the opportunity to be your president this year. You know, the presidency and CMS couldn't be in better hand than Dr. Mark Johnson. So without further ado, I'd like to introduce, it's honor and privilege to pass to my colleague and friends, the Medal of Leadership of the Colorado Medical Society and to administer the oath of office for CMS President. So Dr. Johnson, please join me. And here is the, allow me to provide you with the Medal of Leadership of the Colorado Medical Society. First, and then we're going to do the oath. So please repeat after me. I swear to protect and, can you let's make sure that we're all both on camera. Okay. I swear to protect and uphold the articles of incorporation and bylaws of the Colorado Medical Society.
I swear to protect and uphold the articles of incorporation and bylaws of the Colorado Medical Society.
I swear to support and defend the policies and programs adopted by the Colorado Medical Society and Board of Directors.
I swear to support and defend the policies and programs adopted by the Colorado Medical Society and the Board of Directors.
I swear to faithfully represent the entire membership and best interests of the Colorado Medical Society.
I swear to faithfully represent the entire membership and best interests of the Colorado Medical Society.
Physician members, it's a privilege to present to you the President of the Colorado Medical Society, Dr. Mark Johnson.
Before you go too far, I also have a presentation for you. Sammy, please come back here. On behalf of the members of the Colorado Medical Society, I would like to give you this certificate of service as the president of the Colorado Medical Society and this small token of our appreciation for all that you have done.
Thank you so much, Mark. Thank you for your leadership. Thank you.
I want to begin by thanking Dr. Diab for his leadership over the past year and for the mentorship that he has given to me. One of the things I have learned about Dr. Diab is that he is always like oil on troubled waters. He calms things down. That may not be always true at home, but he has always kept the heat below boiling temperature at our Board of Health meeting, our Board of Director meetings, and I have sincerely appreciated that in all of your leadership. You have been very kind, and you are the consummate gentleman. Thank you very much. Tonight, I especially want to thank your wife, Dr. Lillian Diab, for so generously hosting this here at her home. I think through the day, she's been working harder than any of us getting ready for this meeting. I also want to thank Mr. Brian Campbell and the CMS staff for all of the work that they do. Mr. Campbell is the CMS CEO, and his staff over the past year have been working on very complex, very troubling issues and have done it with professionalism and with class. Thank you very much. I also want to take this opportunity to congratulate Dr. Patrick Pivoto, who just recently was elected to be the president-elect for CMS. I'm sorry he's unable to be here tonight, but congratulations, Patrick, whenever you have a chance to watch this in the future. Many folks have asked me what my initiatives will be during my tenure as the CMS president. I would like to remind them and all of you that 1 year ago, the CMS board identified priorities for CMS, as well as adopted a strategic plan with 1 year, 3 year, and 5 year goals and objectives. I think it would be the height of arrogance for me to assume that I have a better plan and to try to change that strategic plan and those priorities. The board's highest identified priorities were to create a plan for diversity, equity, and inclusion, to protect physicians' rights to confidential counseling and peer assistance, and to retain, engage, and increase CMS membership. CMS councils, committees, task forces, leadership, and staff have been working hard this year on those priorities and will continue to do so in the coming year. The strategic goals of the board were to support members in finding professional satisfaction, to continue to work to provide efficient and effective communication with our members, and to enhance organizational excellence that is recognized with increased membership. While not directly mentioned, the health and well-being of our patients and communities are the foundation on which all of our plans and activities rest. These goals and objectives and priorities remain in place, and I will do all I can to continue the excellent work that is being done in these arenas by leadership, members, and staff. There are 2 additional areas of personal interest, and I believe of special importance to the House of Medicine at this time, on which I hope to focus the resources of CMS, including the involvement of you, our members. I'd like to introduce those 2 issues by reminding you of a game we all learned in medical school that we called morning rounds. To be fair, morning rounds are more than just a game. They are an important part of the learning process in becoming a good physician. They expand your knowledge base, they stretch your critical thinking, they teach you organizational skills, they encourage teamwork, and they fine-tune your inner baloney detector. To prepare for morning rounds, one must thoroughly become acquainted with their patients. They must know each patient's current symptoms and vital signs, their past medical history, their family history, their occupational history, their current medications and their lab and diagnostic test results. In addition, they must know the tentative working diagnoses and all of the differential diagnoses that may account for the patient's current health status. Those are the professional aspects of morning rounds, but there's another side to them, a game I call roundsmanship. As a game, it is a medical mixture of trivial pursuit and jeopardy. One must always be ready to immediately and confidently answer any questions that are put to them by the chief resident or the attending physician about their patients, their diseases, the recommended treatments, and the current relevant and sometimes irrelevant literature. Hesitancy spells disaster. Even if wrong, an immediate and confident answer may buy one time or throw the questioner off their game. These are vital lessons to learn because the medical students who are best at playing roundsmanship are usually the ones asked to join the best residencies. One of the most memorable events in my medical school career happened more than 40 years ago on morning rounds. Our attending physician at the time was the late Charles Brinegar, an internist and diabetologist who had trained at the prestigious Joslin Diabetes Clinic in Boston. During rounds, one of our bright but cocky medical students asked Dr. Brinegar a question about the meaning of a rather obscure laboratory finding on one of our patients. Dr. Brinegar paused, thought for a moment, and then said, "I don't know." I almost dropped my clipboard. I had never heard those words before on morning rounds or from any authority in medical school. This was not part of the game of roundsmanship. I looked at my fellow students and realized that I was not alone in my shock and confusion. The honesty and humility exhibited by Dr. Brinegar were breathtaking. Being the consummate teacher, however, his next words put both the medical student and the world of medicine back in their proper place. "I'd like you to research that question and be prepared to give us a report of your findings tomorrow on morning rounds." Unfortunately, morning rounds have taught many of us physicians to stretch the truth, to obfuscate, or to give complicated and confusing answers to some of the most heartfelt questions put to us, because we feel that we can never say, "I don't know." We have paid a price for this hubris. Based on Harris and Gallup polls and data from the National Opinion Research Center, physicians have fallen significantly in both prestige and people's trust over the past 40 years and have ranked behind nurses, teachers, engineers, and firefighters at various times. In fact, nurses have been the most trusted healthcare professions for the past 20 years. Fortunately, we have not scored as poorly as attorneys, who have ranked as the most arrogant professionals for almost 80 years in a row. We must learn, however, how to tell our patients, our elected officials, and our spouses and partners, "I don't know. Let me research that and get back with you as soon as possible." Over the next year, I hope to continue and accelerate the work begun by Dr. Diab, the senior CMS staff, and some of the CMS committees to restore public trust in the physicians of Colorado, particularly the members of CMS. This is integrally tied to work already being done by the Council on Ethical and Judicial Affairs on defining and disseminating the meaning of professionalism, and by the two new CMS task forces on independent practice and employed physicians, which are working to define the place of medicine in today's changing and challenging world, as well as its role in the marketplace. The other issue that is close to my heart is the role of physicians in organized medicine in the world of public health. As I have suggested in the past, public health is the illegitimate offspring from a short but passionate affair that medicine had with social work in the late 19th century. Medicine was subsequently seduced away by mammon and technology, and social work was left with a sometimes obstinate and needy child and a long-lasting distrust of medicine. Recently, thanks to the COVID pandemic, medicine has rediscovered public health, finds it intriguing, but is not quite sure how to relate to it. My conviction is that medicine needs to actively re-engage with public health for the health of the public. After the influenza pandemic of 1918, public health was given great responsibilities, but little authority and almost no enforcement capabilities with which to protect the people's health. Even that small level of authority is now under attack from many quarters, and if lost, will most likely never be regained. As a long absent parent, I believe medicine needs to once again take up the protection and nurturing of public health. My first activity with CMS back in the mid-1990s was an attempt to protect the integrity and independence of public health in Colorado. While that battle did not end as I had hoped, it did lead to the formation of the Chief Medical Officer position at the Colorado Department of Public Health and Environment, which is currently occupied by Dr. France. By state statute, the Chief Medical Officer has the authority to directly engage with the governor on health-related issues if they feel the necessity. The Chief Medical Officer, as well as the other state and local public health officials, need the support that only CMS and its members can give them in times of great political and medical distress. During my tenure as president of CMS, I will actively be working to rebuild bridges between these two important fields of endeavor. Thank you once again for the honor of leading this great organization at this interesting and disruptive time in healthcare. From all indications, it appears that there will be numerous battles to face in the year ahead on both the social and political fronts. These cannot be fought by leadership and staff alone. It will call for every ounce of trust, prestige, and wisdom stored up in each and every CMS member to successfully face the challenges ahead. From past experience, I know that we can count on all of you to do your part as we move forward. Thank you very much.
Thank you so much, Dr. Johnson. Wonderful speech and inspiring as always. So let's raise a toast here to celebrate Dr. Johnson. Dr. Johnson, to a great year. Okay, music is next.
Stick around, everybody. We've still got a lot of raffles to go after the music, so stay with us. We still have more to come.
What I want you got what might be hard to handle. I like a flame that burns a candle. Candle piece of flame. Yeah, yeah, what I got full stop. Thoughts and dreams scatter when you pull them all together. And how I can explain. Oh yeah, well, well, ooh, 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 ooh. You make my dreams come true. Ooh.
All right. Thank you so much, Lewis and team, and we really appreciate that. We've got some more raffles going now, so we're going to go ahead and start. The first one is a $50 Visa gift card and certificate for a 1-hour consultation for travel. This is valued at a $200 total value, and this is from Cruise Partners, another one of our valuable partners in medicine. And so I think we're ready. Let's go ahead and spin that wheel and see what we've got. Oh, she's in the other room, but I'm going to yell out to her. Congratulations, Deb Parsons, on winning a. Yeah, you want a $200 value from Cruise Planners. So congratulations to you, Dr. Parsons. All right, so we know where she is, and we will get in touch with her in just a moment. Now we have a pair of tickets for an upcoming Colorado Avalanche game. Ooh, I should have kept myself in contention for this one. This is the game on October 24th, and this is provided by our event sponsor, KeyBank. So thank you so much to KeyBank for the tickets, and we're going to go ahead and spin the wheel again and see what we've got. Ellen Arendt, Dr. Ellen Arendt, thank you so much. And we have another winner. We're going to get in touch with you in the chat. And we have one more that we're going to hit at this time. And this is from our friends at Minds and Associates. And they have a $50 Amazon gift card, $50 Amazon gift card from our partner in medicine, Minds and Associates. So let's go ahead and spin that wheel. And I think we might have a Minds and Associates video too. If that's the case, we've already gone way past it, but we could definitely go back to it. But while I'm talking, Susan Bennis has won. So Dr. Bennis, congratulations on your win, and we will get that information to you as well. All right, thank you to all of the partners in medicine, cruise planners, KeyBank, and Minds and Associates. And if I was looking ahead on my script, I would have already known now is when we're going to go to that video from Minds and Associates, our partner in medicine. Following that, we're going to have a quick song and then six more raffles. So stay right there. Pay attention to this video from Minds and Associates. Take a listen to a little music, and then we'll give away some more stuff.
My name is Danny Kimlinger, CEO of Minds and Associates. Minds helps to support Colorado physicians by offering behavioral health support, resilience, and stress management programs that help physicians counter the daily obstacles and life situations that they face in today's stressful climate. Through Minds, CMS members can purchase a practice assistance program, which includes a suite of services, including counseling, work life, legal, financial, mindfulness, resilience, and leadership support. We can also offer crisis support and an online physician burnout program, and CMS members are eligible to receive preferred pricing. Please call Minds at 1-800-873-7138 or www.mindsandassociates.com.
All right, thank you so much, Lewis and your band. Appreciate it. It's been great having you guys with us tonight. Would have loved to have had you live with us. Maybe we can come back and do that next year. But we are down to the end of the evening, folks, and we have 6 more raffles to get to right now. The very first one is a $300 Amazon gift card from G2Z Law Group, our partner in medicine. So let's go ahead and spin that wheel and see what we've got. Putting in my production notes for next year, I really want a sound effect to go along with that. And it looks like Jeannie Pritchett. Jeannie Pritchett is our winner. Congratulations, Jeannie. Just a reminder to all of the winners, make sure that you in the chat, you're going to get communicated from our staff, and they're going to make sure that, that they get everything they need to get your information, get you your prize. So next, we're going to go to Abide. Abide is one of our partners in medicine, and they have provided some Apple AirPods with the charging station. So let's go ahead and get to the wheel. Let's spin the wheel and see who is going to take home some Apple AirPods tonight. Oh, look at that. And we've got the sound effects going. Fantastic job, team. They are working behind the scenes. All right. Well, oh, and the applause and everything. That is fantastic. Morgan Weatherly, congratulations on your win. And congratulations on those new Apple AirPods. All right. Now we have an Alexa Echo Show. And this was donated by our friends with Favorite Healthcare Staffing. Favorite Healthcare Staffing, one of our new partners in medicine, and really glad to have them on board. And that's the Echo Show there that they're going to be giving away. And so we'll go back to the wheel and see if we can find another winner here. All right, Alicia Garth. Alicia Garth is the winner. Congratulations, Alicia. All right, and we're going to keep on moving on. We've got 3 more of these to give away. medical telecommunications, or if you need those answering services, this is a proud partner in medicine, medical telecommunications, and a great partner with the CMS. We're going to give you a $75 gift card tonight. Let's spin that wheel and see where our winner is. Audrey Hall. Audrey Hall is the winner. Congratulations. All right, we're going to keep moving on. Now, your morning swim can have a playlist thanks to Medicare insurance. We're doing with a donation of Swim Buds Flip. So you could swim in these and listen, or, you know, music, podcasts, whatever you want to listen to. I'm a podcast guy myself. So let's get to that spin. Julie Lay is the winner of the Swim Buds Flip. Congratulations, Julie. And I miscounted. We've actually, looks like we've got two more. We've got, yeah, I think, oh, I'm gonna check with my team to make sure I'm reading my script right. But I know the next one is a $100 gift card from Copic, and this is an Amazon gift card. And so let's spin the wheel and see who we've got as a winner of this. Sorry, guys, I was talking too fast and saying two things at once. So they're just trying to follow me back there. All right, the $100 Amazon gift card from our friends at Copic. Going to go to Christine Stone. Congratulations, Christine. And we might have one more. We do. So we have one more giveaway, and this is yet another pair of tickets to that October 17th game against the Raiders, the Las Vegas Raiders. It's still weird to say, isn't it? So, all right, we've got two more tickets, and this is the last one of the evening. So let's make that final spin. Cross your fingers, feel lucky, and let's see if we can find one more winner tonight. Anissa Porter, congratulations on winning those two tickets. And that is all that we have in terms of the prizes tonight. Thank you so much for being here, and appreciate everyone participating in our virtual experiment this year. Can't wait to get back in person. And I'm just going to leave you one last time with the newly minted president of the Colorado Medical Society, Dr. Mark Johnson.
On behalf of the professional leadership and the staff of the Colorado Medical Society, thank you so much for joining us this evening. This now concludes the 151st annual meeting of the Colorado Medical Society. Stay well.
Deep down Louisiana, close to New Orleans, way back up in the woods among the evergreens, the state of log cattle made of earth and wood. They lived a country boy named Johnny B. Good, who never ever learned to read or write so well. He could play just like a ringing bell. Go, 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 Johnny, go, 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 Johnny, go, 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 Johnny, go, 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 Johnny, go, go. Johnny B.